At this time, we have a COVID-19 update. We have Mr. Bill Webb, the health officer here in Kent County. Mr. Webb?
Good morning, everyone. I want to thank the commissioners for the opportunity to update you on the COVID-19 situation in the county and also the opportunity to address the community. Before I get into the details, I do want to praise all of our county partners who have been assisting the health department. We could not do what we do without the teamwork that has been evidenced by the Emergency Operations Center and everything that Mr. Darrell has coordinated. I would thank each and every one, but this is a long meeting and I want to keep my comments brief. I also want to take this opportunity to thank the commissioners for the kind gift of the superhero painting where they're paying respects to healthcare workers. That picture now hangs front and center in the lobby of the health department. It's there, and it's an honor that we greatly receive and display for all to see. Okay, overall, Maryland conditions related to COVID-19 have been improving in the last 3 weeks. Hospitalizations, new cases, and positivity rates are down, while COVID testing and PPE supplies are up. Unfortunately, not all states have fared similarly. Spikes in Texas, South Carolina, and Florida, to name a few, demonstrate that the virus can flare up given the opportunity. If Maryland is faring well, Kent County is doing even better. Our numbers have improved across the board in the last 3 weeks. On many measures, we now are doing better than the rest of the state. So here are some of our current numbers, and these numbers are, as of 6/29. Since we last spoke, there have been 12 additional new cases, and we last spoke on the 8th of June. So 12 new cases. That brings our case count up to a total of 199. Of the 12 new cases, 2 have been nursing home cases. One of the nursing homes in question is not in the county. It is an employee who works at an out-of-county nursing home but lives in Kent County. We've had 10 community spread cases, and at this point we only have 1 nursing home that is in an outbreak situation, and that is the resorts at Chester River Manor. Approximately half of our cases, total cases, have come from nursing homes, but community spread now is significantly outpacing nursing homes. Overall, we have 22 confirmed deaths. That's an increase of 3 since we last spoke, and all 3 were related to nursing home cases. As far as testing goes, Kent County Health Department opened up drive-through testing on the 8th of June, and since that started, we have performed 450 tests, and overall, the county has tested 12.1% of the population. The statewide goal is from the Maryland Department of Health is to test at least 10% of our population. Kent County is in the top quartile. We are number 4 in the state related to the percentage of population that we have tested. Additionally, and more importantly, our 7-day positivity rate, that is the number of people who test positive out of everyone who has tested in the last 7 days, is 2.26%. And that's almost half of the state rate at 4.9%. As far as the hospital capacity goes, the University of Maryland Shore Regional Health over the last 3 weeks has consistently reported bed availability at all levels of care. So this is all good news. Now I want to talk about the nursing homes and reopening of nursing homes. On June 19th, the Maryland Department of Health issued guidelines for relaxing restrictions that are in nursing homes. Currently, nursing homes are very tightly controlled, and for any family, any individuals who were there or family members who were trying to visit, it's very difficult to have family members there because the residents typically are confined to their rooms, and they have very limited social interactions, as is necessitated by the nature of this particular respiratory virus. So the situation has improved significantly enough across the state that there is now a pathway for reopening nursing homes. It is a detailed and comprehensive 3-phase plan that has been mandated by the department. It's based on having 28 days of no COVID cases, weekly testing of staff and residents if an outbreak is in progress. They have to have a normal staffing situation and an ample supply of PPE. When they reopen, it will start with limited outdoor visitations, communal dining, and small group activities. At this point, none of our nursing homes have entered phase 1, but I expect Heron Point and the Peak Healthcare to be ready shortly. One of the things I do want to mention about this plan is nursing homes are being asked to start paying for staff testing effective August 1st. This is, the test costs approximately $100 per test, and this has a potential to put a significant financial burden on these facilities. It is a very significant but necessary expense if we are going to get to conquer this particular virus. And I appreciate all of the sacrifices that these businesses are making to ensure that the care of their residents is of the highest caliber, and all of the hard work that they're doing. Additionally, there has been guidance related to assisted living programs. Assisted living programs are a little different than nursing homes. It's a lower level of care. The residents have a little more independence. They have, and at this point, that guidance was issued on June 26th, and the health department is going to be briefed today at 2 o'clock from leadership about that plan. I do want to say that Kent County has been exceptionally fortunate that our assisted living programs have avoided any outbreaks. I'd like to take this opportunity to praise them for all they have done in the last 4 months. It truly is exceptional. In terms of, now I want to change the subject and talk about our community testing strategy at the health department. For the last month, we have been doing drive-through testing at the Public Works Garage. That has been an unqualified success. That has moved smoothly. We have gotten positive feedback from everybody. But unfortunately, the weather, as we get into the heart of the summer, it's very hot and uncomfortable for our staff to be outside and doing the testing in all of that protective gear. So, we're looking at a longer-term solution. We are going to be moving into an office, an office-based location. It's at 514 Washington Street, Suite 118. It's next to the LabCorp office. We hope to have that starting next Monday, July 6th. That of course depends on whether we can get the office is painted. Hopefully we'll be able to find some folks to get that painted this week. The hours are going to be the same at the outset. It's going to be Mondays and Wednesdays, 8:30 to 12:30, and just like the drive-through, there's no cost. A physician order is not required. We just ask that everyone make an appointment before you come, because that's what that's going to help backups, delays, and lines avoid any of that. We anticipate that we can do 50 tests per day in the office, and we can certainly increase capacity if the need is required, and we can go to 5 days a week with the staff that we have. We just need to get all of the kinks worked out for the office-based process. Our contact tracing has been successful. Obviously, having a low volume of new cases has helped significantly. We have a new full-time staff member starting tomorrow, and we do have, the state has new contact tracing software that has multiple issues that we're still working through, but that's to be expected for a product that was developed in about a month for a state of 6 million people. So we're working through that. The contact tracing is a vital important of getting somebody who tests positive to get them quarantined or isolated as soon as possible. That's what is going to help mitigate the impact of this virus, the testing and the contact tracing. The Whitsitt Center, I just want to mention that we had originally planned to open today, but we needed to postpone to next Monday due to some, just some logistical issues and, some procedural items procedural changes that we're making related to a reorganization at that facility. I also want to mention the Public Health Cares funding. That's the federal funding that the county has received for dealing with this public health issue. At this point, the health department has paid out approximately $75,000 in invoices for county and municipal health expenses. Just want to remind all of our identified agencies to move forward with the spending process. December 30th will be here before we know it, and we don't want to lose out on this opportunity. Moving forward, our most immediate challenges, today. At this point, we have a number of large congregate organizations that have been closed that we're looking to get opened into the future, specifically the schools and the college. Those are vital institutions in our community that we really can't, say that we're, in a successful place until they're up and running and open. They are vital to our community and to the kids, and also to the well-being of our community. Schools are open. Schools will open in approximately 6 to 8 weeks. There are a lot of details to work out. Dr. Couch and the Kent County public school system has been working exceptionally hard to develop plans for a safe and successful school opening. My praises go out to her team for all that they're doing. This is probably one of the busiest summers they've ever had, and it is a monumental task to reorganize the school system to have a safe and effective environment for our children. Washington College, we're facing the same challenges, except that we have the added dimension of congregate living both on campus and off campus. Washington College is a vital partner with the health department in developing plans for having a safe return of students. At this point, many of their plans are still also in the process of being decided. Other challenges that we face, obviously the nursing homes, which I mentioned, nursing home and assisted living. The health department faces, for the health department we're in the process of resuming our regular operations, and resuming regular operations and continuing COVID-19 activities is going to be quite a challenge to do that simultaneously. Many of the activities that have been put on hold need to come back online, and managing the expectations and also the tasks is going to be, that's going to be a juggling act. But we're hopeful that we will see a continuation of the trends that we have in the state, and I'm optimistic, but we do have to be prepared for a reemergence of the virus. And finally, another very significant challenge that we have is encouraging our citizens of the relevance of masks, social distancing, hand sanitizer, and making responsible personal choices. With the number of new cases that we have had being so low, it's it's difficult for people to, to personalize that the virus is still here in our community, and if given a chance, will reemerge ferociously. So we routinely field calls about those who feel face coverings and social distancing are an imposition. I do want to take this opportunity to remind everybody that those non-pharmaceutical interventions are what have gotten us to where we are today, and they are going to be the tools that are going to help us conquer this virus and resume operating in a healthy and safe environment. In closing, in the last 3 weeks, we have seen the COVID-19 situation in Kent County improve significantly. Is this the result of a routine seasonal decline in the virus? Or has it been wise public health leadership from our governor? Will we see a resurgence like that in other states? Will there be another deadly wave in the fall? Only time will tell. Kent County needs to get its schools and its college reopened before we can render that verdict. For many, this will be the busiest summer we have ever experienced. What is known is that our community's continued success will rest with the actions and the personal responsibilities everyone takes. Please continue to wear masks. Stay at home if you're high risk. Wash your hands and keep your distance while socializing. Your efforts make a difference. Thank you.
Thank you. Thank you, Mr. Webb. Do we have any questions up here? I'm going to have one question. You said a cost of the test is $100?
Approximately, yes.
So is that, I mean, it's a free test, right?
For our citizens who come to who come to the testing site, there's no cost to them. And most of the funding that is covering that cost right now is federal dollars, and we want to make sure that anybody who needs testing or desires testing in the community has access to it.
How long does it take to get the test results back?
Approximately 2 days.
2 days now.
Mr. Webb, the number that you talked about, the 199 cases that we've had, now obviously I would assume the vast majority of them have since gone away, and
yes.
People have recovered from it. Do we have a way, or do we track the number of active cases? I mean, that 199, I guess that number started in the very beginning, back in March, maybe.
That's total. So I would say that probably, the vast majority of those cases have resolved at this point. With only 12 new cases in the last 3 weeks, that would mean that 170 have occurred prior to 3 weeks ago, and usually it's about a 2-week resolution time. So a significant percentage has resolved. Next time I'll make sure to include that.
So you're saying that it's possible, because obviously in 3 weeks most cases have come to an end, I would assume, in 3 weeks. So it's possible that in Kent County we may have 12 active cases, or somewhere around. I think that number of 199, because we've been tracking that since March. It's a little, well, it's disturbing to say the least, but that's true. It's accurate, but it's comforting to know that for a lot of people, I think that the vast majority of them has ended.
Yes.
Now, some of them, unfortunately, in not the right way, but the vast majority of them have recovered, and hopefully we have very few active cases.
At this point, we don't know if you become infected and get through an illness, or you're asymptomatic and you get and you're positive, that does likely confer some immunity moving forward. We're not sure exactly how long the immunity is good for, but that is good in terms of having people who have gotten through it. But certainly the science behind that is still very early in the process with that. But yeah, a majority of people who do contract the virus do get better. It's the people who are at high risk, those who are older with underlying medical conditions, are the ones who are much more likely to have serious complications from the illness.
And in the beginning, obviously, we had some issues with some of our nursing homes and those people of great risk. But that seems to have stabilized and to a lot better than it was. So we don't have the.
Well, the nursing homes have been working very diligently to keep the virus out of their facility, and the credit belongs with them, and with the procedures that they've been following.
No question about it. Thank you.
As we go into the summer and vacation season, how much of a risk is people going wherever and then coming back to King County? I had heard over the weekend there was an outbreak in Rehoboth Beach, but it tested quite. I don't know just how, but they said like Rehoboth Beach and Dewey Beach.
Certainly there's a risk, but it depends what you do. If if you're someone who goes and hikes in the mountains of Western Maryland, that vacation is going to be fairly safe. Anywhere where there are large crowds of people who are in close proximity to each other, certainly we encourage everybody to think carefully about the risk they're taking and about the activity that they're going to do for their vacation.
So what would be your suggestion if someone, say, went to Ocean City or Rehoboth and comes back? Should they quarantine? Should they? What would be the procedure that those people should follow? Or maybe it depends on what they do when they go there. If they rent a condo and don't go out on the beach and stay inside, maybe there's.
Okay, let me just a short story. Maybe this will help answer your question. My stepfather-in-law is one of these individuals who, and his wife, enjoy going to the beach every summer. I mean, this is part of the fabric of their being. And they came to me and said, they said, Bill, what should we do? And I explained to them, you're welcome to go to the beach. And the way they're doing that is, they rent a house, like a totally separate house. I said, if you go to the beach and you stay at the house and you go out on the beach and are socially distant, away from everybody else, don't go out to eat, don't go shopping, don't do, some of the usual activities. In all likelihood, they're going to be safe. It's when you get on the boardwalks, when you get into the large crowds, when you get into elevators of hotels, that's when all bets are off. So I think that our citizens are capable of making their own decisions and assessing the risk that they're willing to do. But that's what I advised my family members who like to go to the beach, and other people may not have the ability to do that. So it's generally that's what I advise my family members to do.
Well, I think that's good advice, and at the same time, we don't want to. There's businesses down there that need business, and we don't want to be fear mongers in a sense. But I think you have to do what you're comfortable and try to be as safe as you can.
And the crowds we see are not all related to vacationing either.
Right.
You watch television, it's hard to turn on a channel that you don't see a crowd of people. Now, some of them are vacationing and some of them are protesting. And one is just as, they're all the same. It's a number of people coming together, and so I don't think it's I don't think it's out of the question that we see a spike in this problem in some areas that could probably have been avoided to a better time, but nevertheless.
Okay, any other questions up here? If not, Mr. Webb, we appreciate your update again, and looking forward to continuing to improve.
And the one other thing, that the picture that you talked about with the heroes, and that was obviously, we give that to some different agencies, like the police department got one now, and the detention center. I mean, obviously all the pictures show nurses, but it was, you can't get it. I mean, we had to use that, but the idea behind it is that for first responders have been heroes throughout this whole event, and that was the best we could do. We couldn't find one with police officers or detentions. So but the idea behind it, I hope people appreciate how much we appreciate the work that they're doing during these troubled times.
And we're grateful, and it's hanging in a place of honor at the health department.
I'm sure Sheriff Price thought, what are you sending me this picture with a bunch of nurses walking down the aisle? But
I actually hung my picture next to it.
There's no doubt, Sheriff. But the thought was good on their part. I hope you appreciate that.
This time we have Wayne Darrow, our Director of Emergency Services, to give us an update.
Good morning. Real quickly, as far as COVID goes, we've drastically reduced what we're doing in our efforts right now. It's been good for us because we have some major projects that we need to get to this year. In the last couple of weeks, we've been able to do that. So the frenetic time has kind of slowed down for us a little bit. We are continuing with our EOC meetings. They are just once a week now on Thursday mornings at 9 o'clock. Wednesdays when we seem to see the governor's announcements come out, and we also have a Maryland Emergency Management meetings that are reduced to once a week on Wednesdays. So with that information from Mr. Webb and from what I'm getting from MEMA, we didn't have those meetings on Thursday. And we've been doing it about 2 weeks now, and it's been effective, although we're monitoring it. If we need to go back to more frequent meetings, we will do that. And the main conversation that we're seeing out of MEMA is just what Bill talked about, is monitoring the state's numbers and also what's happening in those other states where they're having outbreaks and what we get to do to avoid them. And that's the major conversations we're having right now. Our 3 major projects have gotten underway: the hazard mitigation plan, the replacement of our computer-aided dispatch system, which is much overdue in the 911 center. And then we received 4 responses to the Eastern Shore EZNet Next Gen 911 project 2 weeks ago, and we're starting to evaluate those and have those in place within the next 10 months or so. So big projects going on. I do have a concern that I will share with you, is that we need to be concerned about our EMS staff for the county. There's some indications I'm seeing that some of the men and women, it's not the same job anymore, with this virus out there. So we might lose a couple, especially the ones that are older that can move on. The job is just different. So we'll keep an eye on that. It's something I'm concerned about, but we'll keep an eye on it and we'll try to replace it. It's an industry-wide situation that's happening everywhere. And you're seeing it in all public safety, I think. So
They have fear that they might
I'm not sure, Commissioner, that it's the fear, because they've been doing the job and they're doing the job well and they're protecting themselves. But it's just a different job now. It's not, every call you go on, you have to be concerned about it, and you have to be concerned about taking it home to your family, and that pays a toll after a while. So we're kind of monitoring that and see how it goes. And like I said, it's not just us. I have conversations with other directors on the shore all the time, and they're seeing the same thing too. So it's just a concern that we have, and we'll have to work through it. The other concern will be who we're going to replace them with, because there's not as many people going to be coming into the profession at this point right now too. So, but we'll keep an eye on it. We'll make it work. So, and that's all I have as far as an update for you.
I might like to mention one thing, and this isn't. Yesterday I had the experience of, I was on a tractor with the bale, turning into a farm, and here comes the EMT, and no lights, no nothing. turn signal on, I'm ready to turn, and they're flying by you. Now, I wish there was a car in front of them that did it first, but I guess I'm thinking we all need to be a little careful with farm equipment, particularly this area.
Yeah.
And I think our county or that they even need to be more aware of that. I think than, you know, this car from Pennsylvania, but I mean, when I'm turning left, I put the turn signal on, and I pull to the center of the road, which should indicate that the person's getting ready to turn. And I guess this is more important to me since I was hit once by a car turning.
But we see that with tractors and stuff every year, though. We have instances where people think they're passing a slow-moving vehicle when the vehicle is actually going to turn.
Actually going to turn, and in most, like I say, I had a turn signal on, but it was more concerning the fact that here was a county vehicle that was.
Then you get that information from your time and place from you later on and all.
Well, and I'm not wanting to get anybody in trouble. Don't take that to the, I guess I'm just more or less saying this to maybe mention to your people that, let's be aware of, but let's make sure that this farm equipment's not turning or.
Yes, sir.
Not,
we'll take a look at it.
Any other questions?
No, I'm good, thank you.
Hey, thank you.
Thanks,
We appreciate everything you're doing.
No question about it.
Mr. Webb, we appreciate everything that your department's doing. I know it's been a rough time. Hopefully we're gonna pull through this and be better for it.
Can I bring up something?
Yeah.
That's when Bill's here. Betterton Beach. What are we doing with Betterton Beach? I saw in the news last night, Queen Anne's County was on the news last night because Queen Anne's County beaches are getting inundated with people from the outside.
Well, we took care of that.
We have Betterton Beach, so we did take care of that and just said local residents only.
But I am glad, I'll go ahead now.
No, I was just saying that, are we allowing people to be on the beach with blankets, swimming? I mean, I know we don't have lifeguards, swimming during risk.
What I've been told as of yet, and somebody called me about that yesterday, was your wife, or my wife could take her grandchild to Betterton Beach, but you can't take a lawn chair to sit in while they're watching. The kids can't take a bucket and shovel to play in the sand. There's no toys allowed, no way to sit down. You can go down, you can swim. I just think, I'm not sure what keeping, not allowing a mother to take a lawn chair with them, or the child to take a bucket and sand if they're going to the beach, has to do with this in any way, shape, or form. I think that's going a little too far.
I don't think there's much difference between outdoor dining and being out on the beach, if that makes any sense. Because, if you're out on the beach, everybody kind of spreads themselves out anyway.